Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you is a nice tip or potential pitfall of Mitomycin-C-induced urothelial atypia. So this is a case of a 51-year-old male patient who is known to have low-grade papillary urothelial carcinoma, for which he received Mitomycin-C. And this is actually a follow-up cystoscopy and biopsy. And the first thing that would come to mind once you see this on low power magnification or intermediate power magnification is this dysplasia, is this carcinoma in situ, because there is variation in the nuclear size and appearance. There is loss of polarity where some of the nuclei change their position while the cells are reaching into the surface epithelium, into the umbrella cell layer. There is some variation in the nuclear sizes and shape, as well as mitotic figures here and there. But mind please the presence of eosinophils scattered along the different layers of the urothelium. This is another focus, and again you see some loss of the urothelium here, some atypia, loss of polarity, hyperchromasia, irregular shape, wrinkled nuclei, all would really cause some concern whether the patient is now having even worse than the low-grade urothelial carcinoma, whether the patient has carcinoma in situ or at least dysplasia. But again, if you look at the urothelium itself, it harbors many eosinophils, and if you look at the subepithelial connective tissue, there is edema, congestion of the vessels, and plenty of eosinophils. And to zoom in into the subepithelial area, where we have the congested vessels, the edema, extravasated red blood cells, and plenty of eosinophils. Look at this focus. Really, the number of eosinophils should be an excellent clue to the possibility of drug-induced changes. This is why you have always to check the history of the patient and whether the patient received any form of intravesical treatment. Now, cytokeratin 20 was in areas confined to the umbrella cell layer, but in other areas was slightly more widely expressed. However, this was only confined to the superficial layers of the epithelium, which gives some a clue that this is probably only because of regenerative changes rather than a true dysplasia or atypia, because we do not really have full thickness involvement of the urothelium by cytokeratin 20. P53 showed this beautiful mosaic pattern of staining, with some tumor nuclei are positive strongly, others are positive weakly, and yet others are completely negative. The Ki-67, of course, was increased because we could see some mitotic activity. However, most of it is really confined to the basal and parabasal layers of the urothelium. So the final diagnosis in this beautiful example is urothelial atypia that is induced by Mitomycin-C. Remember that this intravesical chemotherapy can induce atypia that looks very similar to dysplasia or carcinoma in situ. This is why you have always to check for the history of the patient and whether the patient received any form of intravesical treatment. Remember that an excellent clue would be the presence of eosinophils, whether this is on top of the epithelium, intraepithelial eosinophils, or in addition, the presence of the congestion and the eosinophils in the subepithelial connective tissue. The eosinophils, even in voided urine, the presence of eosinophils, especially if they were in abundance, is an excellent clue to the potential of drug-induced changes whenever they are encountered. So with eosinophils, you have always to be careful not to render a diagnosis of dysplasia or carcinoma unless the possibility of a drug-induced induced changes is excluded. I hope you find this tip useful in your daily practice. Thank you.